Today I will talk about osteosarcoma. Osteosarcoma is a malignant tumor that produces osteoid matrix or mineralized bone. Excluding hematopoietic tumors, osteosarcoma is the most common primary malignant tumor of bone. Osteosarcoma has a bimodal age distribution. 75% of osteosarcomas occur in persons younger than 20 years of age. The smaller second peak occurs in older adults, who frequently suffer from conditions known to predispose to osteosarcoma, such as Paget disease, bone infarcts, and previous radiation. These are referred to as secondary osteosarcomas. Overall, men are more commonly affected than women. The most common sites in adolescence are the metaphyseal regions of the distal femur and proximal tibia. Osteosarcomas present as painful, progressively enlarging masses. Sometimes a pathologic fracture is the first indication. Radiology. Radiographs usually show a large, destructive, mixed-lytic and sclerotic mass with infiltrative margins. The tumor frequently breaks through the cortex and lifts the periosteum, resulting in reactive subperiosteal bone formation. The triangular shadow between the cortex and raised ends of periosteum, known radiographically as Codman triangle, is indicative of an aggressive tumor, but is not pathognomonic of osteosarcoma. Pathogenesis. Approximately 70% of osteosarcomas have acquired genetic abnormalities such as complex structural and numerical chromosomal aberrations. It also is noteworthy that osteosarcomas peak in incidence around the time of the adolescent growth spurt and occur most frequently in the region of the growth plate in bones with the fastest growth. The increased proliferation at these sites may predispose to osteosarcoma development. Morphology. Osteosarcomas are bulky tumors that are gritty, gray-white, and often contain areas of hemorrhage and cystic degeneration. The tumors frequently destroy the surrounding cortices and produce soft tissue masses. They spread extensively in the medullary canal, infiltrating and replacing the marrow. Infrequently they penetrate the epiphyseal plate or enter the joint. The formation of osteoid matrix or mineralized bone by malignant tumor cells is diagnostic of osteosarcoma. The neoplastic bone usually has a fine, lace-like configuration but also may be deposited in broadsheets or as primitive trabeculae. The tumor cells vary in size and shape and frequently have large hyperchromatic nuclei. Bizarre tumor giant cells, vascular invasion, and necrosis are common. Mitotic activity is high, including abnormal forms.